Good evening, everyone. Today we're going to talk about Metoprolol. No cartoons for me. I'm going to be my own cartoons. So let's start about use and description. It's a beta blocker, and the medication basically work as blocking the action of certain natural blocking agents like epinephrine. Therapeutic effects basically decrease blood pressure, heart rate, and off-label, it can help for migraine prophylactic, anxiety, and aggressive behavior. Mechanism of action, it's a beta 1 and beta 2 adrenergic receptor. So beta 1 located on your heart, beta 2 on your bronchial. Next one, mechanical of action for hypertension, myocardial infarction, and angina pectoris. Mechanical of action the same, but we can add that it blocking, by blocking the catecholamine receptor, it will lower the need of oxygen from your heart and decrease angina and pain, and also like myocardial infarction. On the pharmacodynamic, an important thing that it's metabolized by the liver. 7%, so it's a genetic aspect, do not metabolize well due to the CYP2D6 enzyme. So you will have more free drug in your blood and risk of adverse medication. Half-life 3 to 7 hours, and for the time action, PO duration 6 to 12 hours, and extending release for your patient will take only once a day. Duration is 24 hours. Adverse effects, mostly cardiovascular area, of course, with bradycardia, heart failure, hypotension, peripheral vasoconstriction. Also on your respiratory, remember beta 1 and beta 2 for your heart and lungs, so you will have some bronchospasm or wheezing effects. CNS, fatigue, weakness, anxiety, and don't forget for your male patients, erectile dysfunction and lower the libido. Warning, well, we have a lot, so basically be careful about heart failure. Metoprolol can cause a depression of MI and precipitate heart failure. Ischemic heart disease, and be careful during the major surgery. Basically, do not stop metoprolol abruptly. If you stop it, you can have like what we call like a rebound and a risk of ischemic heart disease. And during the major surgery, if you stop metoprolol, you have a reflex adrenergic stimuli that can be dangerous for your patient during surgery or anesthesia. The rest, I will let you read by yourself on the slide, but it can mask some underlying disease like hypoglycemia or hyperthyroid and thyroid storm. Clinical trial we're going to talk about. Next slide. That's the three most study that we did. Myocardial infarction clinical study. Same, like I will send everybody the PowerPoint so you can see by yourself. But basically the sample was for 1,395 patients. The goal is to study the safety of the medication. And the study made by the DCA, by the way, showed that the metoprolol was a reduce of 3-month mortality by 36% of the patients. Another clinical study made for hypertension and angina pectoris. For hypertension, it showed that it's a well and safe hypertensive medication that you can use alone with a diuretic. And angina pectoris, low dose 3 to 4 times a day will reduce the angina pectoris attack. Thank you for listening and have a good night.